Hello and welcome to the Invigor Medical Podcast. I'm Natalie Garland here with my lovely co-host Derek Berkey.
Howdy.
We are same side today, which is a little bit weird.
This is a bit odd.
It's a little bit odd. We're used to having most of our guests via the internet.
Yeah.
But we're lucky enough to have our guest in studio today. I'm very excited to have in the studio Dr. Jared Bloxham, who is an orofacial pain specialist and dental/sleep medicine expert. And Dr. B accidentally fell into becoming an expert in sleep apnea. Really excited for Dr. B to share his expertise in sleep and sleep well-being and achieving optimal sleep and kind of coming at it from a bit of a unique angle. So welcome to the studio, Dr. B.
Yeah,
We're
thanks
so
for having me.
excited to have
I'm glad
you.
to be here.
Yeah, we've already done, as we typically do, a few pre-conversations before we hit record. And then it's like, I want to keep going. I'm like, no, save it for the podcast.
Yeah.
So I think if anybody listening is hearing, accidentally became an expert in sleep apnea, like how does that even happen? So maybe just start with giving us a little bit of the background on, what you got started in and then kind of how it evolved and got you here.
Yeah, so I'll tell my story real quick.
Yeah, please.
So I was graduated from dental school actually in 2003 and was a general dentist. And so I opened a practice in 2005 here in the Tri-Cities. And over the years, I'd had some neck injuries and some neck problems earlier on in life. And over time, those started to cause some problems for me. And I ended up with some...
like leaning over being a
it's a
dentist
rough
and
job
like, yeah.
for anybody with neck or shoulder injuries.
Sure.
And so I ended up having to have a couple of neck surgeries, had a disc replacement and a fusion, and I couldn't do the bent over drill and fill anymore. And so I had to retire and sell my practice. And
Probably not what you were expecting
no,
at all.
not what I was expecting
not
at all.
Not in the
It was
20-year plan.
no, it would. Retiring early, hey, it's nice. But
Right.
when you're not ready for it and when it's forced upon you, it's a little bit different than
Sure.
if you choose it. And so retirement and I didn't get along. And so I ended up going back to school to do a residency and a master's degree in oral medicine and orofacial pain with the University of Southern California. And so with that, I was able to do a lot of that online. And then I was down there in person doing some of the clinicals. But one of the issues that I have myself are nerve issues and pain in the head, neck, and face. And so when I started kind of doing a little bit of research into that, I was like, hey, this is some pretty cool stuff. And I don't have to do that bent over drill and fill. And I can really help people that are dealing with some of the same issues that I have.
Yeah.
And so
Sure.
I went through that program and then came back to the Tri-Cities and opened up a practice 2 months before COVID hit.
Oh,
and so,
great. Such a
yeah,
fun time.
yeah, if you could go back in time and talk to yourself, I'd be like, just take it easy, hold on a little bit.
Yeah.
But so we got shut down, of course, like
Right.
everything else for a while. And then as soon as the restrictions were lifted, we were able to get back into practice. And the sleep aspect of it, many years ago, probably 12 years ago here in the Tri-Cities, I was working with a sleep physician as a dentist, and we were making oral appliances for patients that couldn't tolerate a CPAP. It's one of the alternatives to a CPAP machine for sleep apnea. And he was like, if you're going to be sending patients over here to get these sleep studies done, you should probably get one done yourself. And so I did. I went and I got the sleep study done. So you go and you're basically sleeping in a hotel room with cameras watching you and people watching you, and you're attached to a whole bunch of different monitors. And it's like, here, let's attach you to everything and now sleep really good. And so I did that. And then the next day he called me up and he says, we need to talk. And so I went into his office and he's like, yeah, you have severe sleep apnea.
Wow.
And I was like, well, my wife and my kids told me that I snore, and I just thought I was getting older.
Yeah.
And I started to recognize some of the things in my health that were associated with poor sleep. And so when I later went back and did my residency and training in orofacial pain and oral medicine, and I didn't realize how deep into sleep I was going to have to get. So one of the things that we were working on, they're teaching us dental sleep medicine and oral appliances and how to recognize these, and it kind of took over. I started recognizing some of my own issues, and then from an orofacial pain standpoint, because that's kind of my specialty is orofacial pain, a lot of the individuals that came in that had jaw joint issues and facial pain from muscle issues, it was related to sleep-related breathing disorders.
Wow.
And I didn't realize how deep into that I was going to have to get. And so we actually changed the name of our practice to recognize that. So now our practice is the Columbia Center for Sleep Apnea and TMJ.
Wow.
And so we'll have some fun stuff to talk about today.
Yeah,
awesome.
I think the thing that excites me the most is I think anybody who's on a path of bettering themselves for health and longevity has some idea of the importance of sleep and the quality of your sleep, has some idea, and has probably looked up something or heard something about how to optimize sleep, how to get good sleep, how important it is. And I'm excited for this conversation because I think it's going to open up a whole pathway of like, holy smokes, I never even thought about that being an issue for sleep. Because I think there's this idea that it's like, oh, if I fell asleep, by 10 and I don't remember waking up till 7, I got a good night's sleep.
Yeah.
Fact or fiction?
Fiction.
Okay.
So we can get into the talk,
Yeah.
and we'll dig a little bit deeper into this. But the quality of sleep versus the quantity of sleep. So and we sleep in stages. So our brain is going through different activities as we're asleep. And somebody can go to sleep and wake up in the morning, and the alarm clock will say, "Hey, good job. You got 8 hours of sleep." And your body's telling you there is no way you got 8 hours of sleep. And so the quality of sleep versus quantity of sleep can be very different. You can get your 8 to 10 hours of sleep, and your body might not get the same regenerative and benefit as getting 3 hours of quality sleep.
That's really interesting. So what are some of the main factors that can cause the discrepancy between quality of sleep and quantity of sleep?
So a lot of times the quantity of sleep, some of us feel sleep is like a nuisance. Yeah. It's like, I'm going to go to bed at 10, I'm going to wake up at 6, and, so there's my 8 hours, and we're going to call it good. But again, if you get that 8 hours of sleep, but you're never getting into deep sleep, so either like stage 3 or REM sleep, which is where your brain is kind of, REM is when your brain is really active. Stage 3, your body's going to be getting that regenerative sleep. And I often explain it as like junk food sleep versus nutritious sleep. And when the first couple of stages of sleep, they're just junk food sleep. You're asleep, you're tired, but your body's not going through those same physiological activities that are going to give you a refreshing feeling in the morning where you woke up and you're like, hey, I'm ready to go through my day.
Well, can we just take one moment? Because I think we're going to be talking about the different phases and cycles of sleep probably a lot.
Yeah.
So for anybody listening that doesn't have a really clear picture of what these cycles of sleep look like, would you take a moment and just kind of explain that so we have like a 10,000 foot view leading into the rest of the conversation?
The general is you have deep sleep and light sleep. We actually have 4 stages of sleep that we recognize, and it's stage 1, 2, and 3, and then REM sleep. And stage 1 and 2 are light sleep. Stage 1 is you're usually not in it very long at night at all. It's just you're just kind of nodding off and getting into sleep. Stage 2 is that light sleep where it's still pretty easy to arouse you, and your brain's not going through a lot, your body's not going through a lot, you're just light sleep. And then stage 3 and REM sleep, they're the deep, slow wave sleep where your brain is, in REM sleep, your brain is really, really active. So, but your body is not. And so we can break it down into stage 1, 2, and 3, and then REM sleep, or we can just break it down into deep sleep and light sleep.
Okay,
Gotcha.
yeah. I gotcha. So weird kind of question, but if I feel like I rouse pretty easily, but sometimes my 22-year-old sister's living with me right now, and there's been a couple times where she had to wake me up for something, and I literally gasp, jerk awake when she's like, why do you always do that? I'm like, I don't know, I must be like in a really deep sleep cycle, because normally I'm just kind of like can hear someone come in the room. Yeah. If it's like in the morning and I'm already coming out of sleep, but I'll just literally almost hit her in the face once, because am I in a really deep sleep cycle when
usually
that's
in a deep sleep cycle, it's a little bit tougher to wake you up. So that's usually that transition between light sleep and deep sleep.
Yeah.
So and that's when your brain is just kind of switching gears, where your brain becomes a lot more active and your body becomes a lot less active.
That's funny. Interesting.
So I have another question. You mentioned a term, regenerative sleep.
Yep.
Say that 10 times fast. But what about it? Because so where does that fall in the scale of 1, 2, 3, and what about it specifically makes it like regenerative? Like,
great question.
Is it regenerative for the mind, for the body?
All the above.
Okay.
Yeah. And so when we're in stage 1 and 2 sleep, that's again that light sleep, we're not getting kind of that disc cleanup. So in REM sleep, we actually have the fluid in our brain, our cerebral spinal fluid, is actively moving, and it is doing like a hard disk cleanup of the day's activities. So we're sitting here talking, we're thinking, we're working, our brain is active, it's metabolizing fats, and it is producing proteins that are waste products. Okay. Those protein waste products, when we're in REM sleep, that cerebral spinal fluid actually does a disk cleanup. And so if that is not happening, then you wake up in the morning and we see people that are not getting into REM sleep, they will have memory issues, they'll have cognition issues, they'll have somebody that does not get into REM sleep on a regular basis, they have a severely increased risk for dementia and Alzheimer's.
Wow.
Because those proteins that are generated, they build up and they start to cause some damage and some basically connective issues in the brain where those nerves can't quite do the same things that they're supposed to.
Interesting.
Wow. Yeah. So what are some of the things that keep us from getting from that light sleep to that deep sleep? Because I'm guessing, if I had to guess, it's like most people, it's like they kind of fall into the phase 1 and 2 of that light sleep, and the issue is getting into that 3 and REM sleep cycle.
Yeah, and that's what I deal with mostly, is those patients that don't quite get into that REM sleep. And for the over 40 million Americans have sleep apnea or a form of sleep-related breathing disorder. So we hear of sleep apnea, and we'll just kind of define that. What is sleep apnea? What does that mean? So an apnea is a stop in breathing. And so for somebody to have sleep apnea, they have to have, on a test, they have to have a stop in breathing or a reduction in breathing that leads to a drop in the oxygen levels in your blood.
That's really terrifying when you think about it.
It is.
That's terrifying.
It's even more terrifying if you take like one of the pulse oximeters, that just measures the oxygen in your blood, and you put it on your finger and you hold your breath for as long as you can, and you watch to see what happens. Now, for an apnea, you have to have a reduction of at least 3%. Depending on the testing, it's 3 or 4%.
Yeah.
And so I can hold my breath for about a minute, and I can get my oxygen levels to drop about 2% in that minute.
Oh my gosh. So you're stopping breathing enough with sleep apnea that it's dropping well below what you holding your breath for a minute.
Right.
Wow.
And with the apnea, when we're doing testing for apnea, we'll look at, we like to use numbers. We like to be able to classify things. And so we call it an AHI, or apnea hypopnea index. And that's how many times per hour do you stop breathing to the point where your oxygen levels drop. And for mild sleep apnea, it's anywhere from 5 to 15 times per hour that happens. For moderate, it's 15 times to 30 times per hour that happens. And for severe sleep apnea, that happens over 30 times per hour.
I feel like my heart rate increasing just having this conversation. I'm like stressed about not breathing, even though I'm awake right now. Like I just can't even imagine.
Well, so I was noticing something. I really like to try and dive deep. Like you tell me about this stuff, I'm like, oh man, I'm so interested in like how does it actually work? Because like you hear, you don't have oxygen. That's terrible.
Yeah.
But like, why is that actually terrible? Like, and specifically for sleep quality, obviously we know that if you don't breathe, you're going to pass out
long term.
But
like, you start breathing again with sleep apnea, right? So it's like.
As soon as your brain says, hey, we're in panic mode now.
Yeah.
So your brain and your body go through the same response as if a tiger is chasing you when you have an apnea event. So you have that release of adrenaline and norepinephrine, your blood pressure goes up, your heart rate goes up, and your body goes through quite an ordeal when you have an apneic event. And
I mean, that makes sense.
The problem that we run into from a sleep quality, if you have one of those apnea events, your brain will never let you get into REM sleep. So in REM sleep, that is when our brain is really active, but our bodies, we don't have any muscle tone.
Paralyzed.
Yeah. So your body won't let you get into that deep sleep because you're too relaxed, and your airway will close off, and then that oxygen level will drop, and your brain has that panic response. And so it's from a quality standpoint. Now, from what it does to your body, whenever you have that drop in oxygen, the first areas that are affected by that are going to be the small blood vessels in your heart and the small blood vessels in your brain. Those are the areas that are oxygenated first. And of course, then that oxygen has to go to your muscles and all the other parts of your body. But the small blood vessels in your heart and the small blood vessels in your brain, sleep apnea or any sleep-related breathing disorder increases your risk for heart attack and stroke by over 4-fold. And so 65% of patients that have a stroke have sleep apnea. And it's because it damages those little blood vessels around your heart. So you have the lack of oxygen, and it causes that hypoxia or the damage to that blood vessel, and that's happening all the time. So those blood vessels, they almost get like scar tissue. They harden up, and so it's called atherosclerosis. And so they harden up, and then they start to build up those plaques, so it increases your risk for heart attack, and then same thing happens in your brain, and increases your risk for stroke. And
we had another member or a guest on the podcast named Richard Johnson, and he talked a lot about amyloid plaques. Those
are the amyloid plaques. So that amyloid protein and the tau proteins and those amyloids, those are the plaques that build up in your brain. That when you're in REM sleep, your cerebrospinal fluid does a disc cleanup, clears it out. So it actually flows and removes those byproducts and helps you. So
but if you're not in REM sleep, that's not happening.
If you're not hitting REM sleep,
and if you're having sleep apnea, you're never hitting REM sleep.
Correct.
All right.
So we have a very dismal picture here. So,
it's not great.
So maybe we can look on the bright side. Is like how can people address this? How can we fix this?
Before we go there, though, I'd like to backtrack a little bit because I think we touched on this. I think it was before we were recording. It's kind of all overlapping because I think that it's kind of a twofold question. I'm wondering how many people are suffering from sleep apnea at a mild level who are completely unaware. I wonder if you have an idea of percentages you could give us that, if you could. And the other one being, why is this becoming more and more prevalent? Because I
Okay,
feel like
great
the question
questions.
is right. Like,
Yeah.
it used to not, it's kind of, there's other things that are also happening, from a scientific and health standpoint
Yep.
that it's like, whoa, we never used to see this, but now we are. So it's like, is it just more awareness that's happening, or is there actually more cause and effect going on with something like sleep apnea? So kind of a
There's-
two-parter for you there.
So it's happening more frequently. So we're better at recognizing, but it's also happening more frequently. And so nobody just wakes up one day and they're like, I have sleep apnea.
Right.
It's something that your body has to go through. Now, normally your body has protective mechanisms that are built in. So for sleep apnea, it's for 90+% of us that have it. It is a narrowing of the airway. So you get into REM sleep, the muscles of the tongue relax, the throat muscles relax, the jaw relaxes, and that airway starts to narrow. And the brain your body will recognize that and say, hey, I'm not breathing as good as I can. So it kicks you out of that REM sleep where you don't have any muscle tone, and it kind of kicks you into a lighter stage sleep where you still have some muscle tone. So for some individuals, they will clench the jaw, they'll move the tongue forward. So for a lot of individuals, they'll wake up in the morning and it's like their jaw is tired, their neck muscles are tired. And it's because their body's trying to hold that airway open. And then when we're looking at kind of that cause, that it can even start as young as in infancy. And so we're starting to recognize this in the last 8 to 10 years. We've recognized it a lot more. And so even lactation consultants, speech and language pathologists, and pediatricians and nurses, we're starting to recognize it a lot more in kids and some of these tendencies. But even a child that is breastfed will have a lower chance of developing sleep apnea down the road than somebody who is not breastfed. And that's because the way our bodies develop when they are challenged, they develop stronger and bigger. So like a bodybuilder can, if they're lifting weights hard, their muscles are going to get bigger, their bones are going to get bigger. For an infant that is breastfeeding, they have to work a little bit harder to get their food.
Right.
And so the jaw muscles develop differently, the airway muscles develop differently, the tongue develops differently, the roof of the mouth develops differently, the floor of the sinuses develop differently. So our entire airway develops because the demands are being put on it.
Yeah.
So if you have a child that is that has a nipple from a bottle that's easy to get that milk, and they don't have to work as hard.
Yeah.
Those muscles don't develop the same way. The airway doesn't develop the same way. The jaw doesn't develop the same way, and eventually they're going to be at an increased risk for developing a sleep-related breathing issue like upper airway resistance syndrome or sleep apnea.
And I do remember, I mean, my kids are 11 and 8, and I did breastfeed, but I also pumped
Yeah.
and had bottle. I do remember though, even that long ago, and hopefully there's even more of it, seeing there were a few bottles and cups that were designed specifically to help encourage proper growth of the palate, right?
Yep.
And so, but I mean, I always assumed it was really more for just teeth structure and things like that. It never would have even occurred to me that it plays into, far-reaching into their adulthood and the quality of their sleep and ability to breathe.
Wow.
Yeah.
So that's
and
wild.
So we recognize that a lot more clearly now. And even things like, when somebody is pregnant, the baby even gestationally, it can develop a little bit differently. So we started adding folic acid to prenatal pills and vitamins. And that was to prevent and decrease the risk for spina bifida, which is an opening at the end of the spinal cord. And it's because as the baby is developing, the two sides of the tissues come together and they form at the midline, and those midline structures have to kind of join up. And so we were using folic acid to help that physiological,
Which happens too in the
in the
development
mouth
of the
and the
soft
tongue.
palate, right? Which
Yep.
is when, because you wouldn't know.
Cleft lip and
Thank
palate
you,
develop
cleft.
from
Yeah,
that.
cleft, because that's where it's coming together. That makes sense.
And so just by using folic acid, one of the midline structures is the frenum, or it's the attachment underneath our tongue. And so the incidence of tongue tie has increased, but that tongue tie, what it does is it keeps the tongue down in the floor of the mouth and not up against the roof of the mouth. And that it makes it so that the airway is more narrow, or the dental arch is more narrow, and then that tongue kind of sits back a little bit further, and the airway doesn't develop the same. So
Wow.
it's some of the things that we're starting to be able to tie together are really kind of cool.
That is
Yeah.
really
We're
cool.
starting to catch it. So some of these kids that have these issues, we can correct them and be aware of them, so that when they're adults, we don't have some of these same issues.
Yeah.
Anything else beyond childhood that's playing a role in in this and sleep apnea?
Yeah, kind of continuing forward into adolescence, and we could talk a lot about even with kids, some of the sleep-related breathing issues that we weren't recognizing. ADD, ADHD. 70% of the kids that were diagnosed with ADD, ADHD had a sleep-related breathing disorder.
What?
And we used to
Really?
wonder,
That's
this is really
crazy.
cool.
My gosh.
We used to wonder, why would we give these kids that have ADD and ADHD, why would we give them Ritalin or Adderall? Those are stimulants. So with these kids that are hyperactive, we're stimulating them. Why?
Right.
And what the research was pretty clear about was those same kids that were diagnosed with ADD and ADHD, 70% of them were responding favorably to those medications. It was helping them with their ADD, ADHD. And that's about the exact percentage that have a sleep-related breathing disorder that was not diagnosed. And so anybody that has kids or has been around kids will recognize, hey, when kids are cranky and tired, they are a little bit hyperactive. They're grouchy. They're not able to focus, and they act out. And so we were taking these kids that were beyond tired, and we were stimulating them back up to their baseline level with stimulants.
Interesting.
And so, now it's normal practice. If a child has ADD, ADHD, they should have a sleep study because that needs to be addressed and needs to be investigated.
Wow.
That is very interesting.
Okay, so then back to the first part of that question, because I'm curious before we go into like how can we deal with this, is like I'm curious how many people are suffering from sleep apnea or something close to it that are just completely unaware and are just like spinning their wheels trying to figure out how to get better sleep. Or maybe they think they're doing great because, they go to sleep at 9 and wake up at 7, no issue, they think. But what is that like? Do you have a general percentage of how many people?
There about 40 million people, adults in the U.S., are known to have or suspected to have sleep apnea based off of the studies. But even before that, there's a diagnosis called upper airway resistance syndrome. That's basically a narrowing of the airway. And so that one is a little bit harder for us because we have to do some additional testing. But the general consensus is that about 1 out of every 3 adults has some form of sleep-related breathing disorder that is affecting their quality of sleep.
So how can people, because obviously it's very common, 1 in 3. I mean, there's 3 of us here. 1, 2.
Well, we already said you.
I've already been tested.
Okay, there we go.
I haven't been tested.
You guys must be okay, right?
Hopefully, fingers crossed. But how can someone find out? Because it's like what you're saying is you might not even know that you have this. So what are the telltale signs? Is it just that you wake up in the morning, you feel terrible, and you're like, man, I got hit by a truck and I don't know why, I got 8 hours of sleep? Or are there other signs you can look for?
That's one of the more common ones, and especially when we're talking about the upper airway resistance syndrome. That's basically a narrowed airway, and this is a lot more common. We used to look at sleep apnea and we're like, it's just the fat old men that have it. And then what we recognize is that a lot of the petite females that don't have sleep apnea have the upper airway resistance syndrome. That's a narrowing of the airway. So as soon as you get into REM sleep, that airway narrows down. And so that's harder to recognize sometimes because with sleep apnea, you kind of think of, 94% is for percentages. People that have sleep apnea, 94% of them will snore. So you can have snoring but not sleep apnea. But typically, if you have sleep apnea, you probably snore.
Sure.
And so that'll be one of the big ones. So if your spouse is sleeping in a different room, you probably have sleep apnea. So the noise is a big one. The recognized apneic events where it's like, hey, you stop breathing. I got to kind of elbow you to get you to start breathing again. Those are the ones that are very blatant. Yeah. Some of the ones that are not as, kind of in your face, for the upper airway resistance syndrome, a lot of times it's hard to even tell that they're breathing. So it can be shallow breathing. Some of the kind of the telltale red flags that we see for patients, nighttime urination. That's an interesting one.
Okay, so like getting up to
use the restroom.
Okay.
And that's because anytime you have one of those apneic events, your heart rate goes up, your body goes through a panic response. So your heart rate goes up, your blood pressure goes up, and your body releases a peptide that tells your kidneys, hey, we've got too much fluid on board. So during the middle of the night, your kidneys are producing more urine than during the day. So we'll ask questions to patients like that. Heartburn is another one. So gastric reflux. And that's kind of think of the airway as a tube. And for those of us with sleep apnea, there's a kink in that tube. Yeah. And so your chest diaphragm muscles are still moving, the rib muscles are still trying to breathe air in, but instead of bringing air in easily, you create a negative pressure at the top of your stomach. So you'll actually get that gastric reflux at nighttime, and also you can get what's called laryngopharyngeal reflux. So that's the acidic vapor. So waking up in the morning, we're congested, where it's like, man, I wake up in the morning and I'm congested. It feels like I have allergies. And then by 10 o'clock or noon, everything feels okay and I'm fine. Yeah. So there are a lot of these things that when we start asking patients, some of these questions, they're like, yeah, I do have that. I have that. And we just start like red flag.
Right.
Yeah. It starts coming together, and it's like, well, you know what? And even those active muscles, during the nighttime, from an orofacial pain standpoint, and why it affects the pain so much is during the night, if those muscles are activating to help hold the airway open, they can activate with twice as much force at night while we're asleep than they can during the day, because the body doesn't recognize some of the pressure sensors that tell us how hard we're biting down. So they'll wake up in the morning and it's like, my face is tired, my neck is tired, and it feels like your head's been on a treadmill all night long. And you wake up and you just don't feel good. You don't feel refreshed. You wake up just feeling like, the alarm clock's a liar. There's no way I got the sleep that it said that I got.
That's crazy. I did have a question about the nighttime urination.
Yeah.
How many times is too much? Because and the reason I ask is I know that like as people get older, obviously like the kidneys and the prostate function, like people leak a little bit more as older they get. So how many times is too much, and what can you do to kind of like prevent that from happening?
So part of what you have to do to prevent that from happening is just regulating your fluid intake as it gets closer to bed, just so to make sure that you don't have too much fluid on board. And a lot of it is testing. So if you start to have those issues and you start to have some of those red flags, the only real way to know is to get tested. Yeah. And so like personally, I'll tell a little bit about myself. I got tested when I was 35, and I was like, man, I'm getting up to use the restroom a couple of times a night. And I'm like, is this what it's like to get old? As soon as I had it treated, I don't do that anymore. Really? Wow. So, and I haven't for years, because I've had it treated for years. I don't do that anymore. I got off my blood pressure medication. I got off of the omeprazole that I was taking, because of the gastric reflux and the heartburn, and the nighttime urination went away.
Man. What?
That's incredible.
That's crazy.
Yeah.
I feel like once I got pregnant, now I just like naturally wake up and I'm like, I might go to the bathroom or not. It's not regularly, but like once I got pregnant and then had babies, it was like, I'm just so used to just waking up.
Yeah, that's not going to be sleep apnea necessarily. So, but if you it's when we start to see a lot of these red flags in conjunction just with each other that it's like, hey, let's just get tested. Let's find out what's going on. Let's see what your brain and your body is doing while you're asleep, and let's just find out.
So let's talk a little bit about why this is so important.
Yeah.
Right? Like, why is it so important that if you're having issues sleeping or any one of these things is kind of ringing a bell for you listening, why is it important for a listener to set up an appointment to get all these things looked into so they can improve their sleep?
The health implications that it has are enormous, just from the increased risk in heart attack, the increased risk in stroke, the longevity. So somebody that has sleep apnea, depending on the severity of it, it's anywhere from 6 to 18 years reduction in their lifespan expectancy. And so
that's not a small number.
It's not. No, and especially the increased risk of heart attack. So my father had his first heart attack in his 40s.
Wow.
And there's a family history of that.
Sure.
So when I was diagnosed with sleep apnea and I started recognizing kind of some of those signs, I'm like, I wonder how many of my relatives that have these issues have sleep apnea that is increasing their risk and increasing kind of that damage. And so sorry, I kind of got off on a tangent.
No. I think it's totally fine. And one of the things that I'm thinking about, and I in general enjoy this kind of topic, and I think it's something we talk about a lot here on Invigor Medical is about how to take care of yourself, how to take charge of your own health. Yeah. And I think I'm loving seeing kind of the shift that's happening in the medical and scientific field that's looking at kind of this more holistic and functional medicine approach to things. Because what I'm hearing here is it's like heart issues, low blood pressure, all of these other things that's happening, and you're going to a specialist and you're trying to figure out what this is, and they're doing this test and then they're prescribing this medication, whatever. And what I'm thinking is, if we start with, because I'm always thinking first food. Like food is medicine, medicine is food.
Absolutely.
And that's always where I'm starting to think, and that's a tough one too, though. But man, thinking about this and sleep, which I've always known how important it is, but more and more I'm learning how really important it is. Yeah. Thinking if you've got these bigger, issues, like coming back, it's just to the basics of like, how's your sleep? And what do we need to do to get your sleep on track? And then if that's not improving these other things, now let's go from there. Yeah. You know what I mean?
Yeah, absolutely. And too many times, like you said, it's like you go and you're like, hey, I have these symptoms and I have these signs. And it's like, here, let's write you a prescription for that medication and take care of that. When, hey, the underlying problem, if we fix that, if we address that, we might get rid of all these problems that are downline from it, or at least help them. So one of our goals in any sleep physician or anybody that treats sleep apnea, one of the goals is always, hey, let's reduce the medication that you're taking. And it's amazing how many different medications are related to sleep and sleep problems.
Yeah.
So
Wow.
from the heart medications and blood pressure to anxiety and depression to all sorts of different things that are affected by it.
Yeah.
Well, and I'm thinking about too, like, thinking about the pillars of health and like your diet, your exercise, your sleep, your connections. But like if you're exhausted mentally and physically, it is so much harder to like come home and make a healthy dinner,
anything.
or even to just like have figure out what or make a meal plan, or like get up early enough to get to the gym before you have to get the kids to school and go to work. Like, it's just making so much sense to me that it's like needs more emphasis on the quality of sleep that we're getting.
There's another podcast that I was listening to in preparation for this of just talking about sleep, and there's this guy who's a sleep physician who specifically was trying to focus on athletes. And, obviously athletes and a lot of people that listen to our podcast are like trying to think about how can I optimize my life?
Yeah.
How can I get the most gains at the gym? How can I do all these things?
Right.
And the thing he said is like sleep is the most potent, legal, performance enhancing drug that there is.
Yes.
Yeah.
And it's just like absolutely incredible. Can you dive into
Yeah, I can
that
attest to that
more?
one
And-
personally.
Yeah.
So when I had to retire, I've always been very active and very physically fit. And after I had my last surgery, I was not active and I was not fit. I spent almost a year in a recliner recovering, and I
That's a huge
gained
hit.
over 40 pounds, and I didn't realize that my poor sleep was affecting that significantly. So I got the sleep study and I got the sleep taken care of, and I lost 40 pounds, and I hadn't changed much. I competed in physique competitions, and I was like, man, just waking up and going to the gym when you've not got a good night's sleep, you cannot perform like you should be able to. And so even from a weight loss aspect and a hormone aspect, when you're in when you have one of those apneic events, your body releases adrenaline or norepinephrine and also cortisol. And so cortisol, of course, is the stress hormone. It's one of our metabolic regulators. And so when you're having that cortisol release throughout the night and that adrenaline release throughout the night, now your body can't regulate your own metabolism. And so just getting that metabolism regulated, somebody that has a sleep-related breathing issue and not getting into that deep sleep, they're going to have a lot tougher time losing weight and staying healthy than somebody whose body is regulated like it's
And
supposed to.
what about muscle repair? Like after workouts, if you're working out regularly and you're going to sleep, if you're not getting your regular sleep, are you even in a repair state often enough to build the muscle like you want to?
Not nearly as well as you should.
Okay.
Yeah. So,
And that has to do with growth hormone, right?
Yeah.
Because like the biggest pulse of growth hormone happens while you're sleeping.
While you're asleep.
And is there a specific stage when that happens?
I'd have to go back and look at that one because I don't want to mess it up. But yeah, your growth hormone and your serotonin levels and your dopamine levels and your norepinephrine levels, they're all regulated while you're asleep.
Interesting.
And so that's why we see an increase in anxiety and depression and other issues too for somebody that's not getting good quality sleep and getting into that REM sleep.
Yeah.
I've heard another very important factor for getting really good quality sleep is consistency.
Yeah.
Can you touch on that and like how important consistency is? Because it's like sometimes, it's like everyone, I think this is pretty common. Like people are like, oh great, the weekend's here. I'm going to sleep in, I'm going to stay up super late and sleep super late. But then they have to go back to their regular schedule, during the week and kind of oscillate back and forth. Can you talk about like,
we're trying to fight thousands of years of evolution and body clock circadian rhythms.
Yeah.
So our bodies were designed and built for and evolved to the point where when the sun comes up, the body chemistry says, hey, it's time to be awake. When the sun goes down, the body chemistry says, hey, it's time to be asleep.
Which is why I struggle this time of year. My body says, I'm sorry, the sun is not up. What are we doing?
Exactly. And that's because with melatonin, you've probably heard of melatonin. Melatonin is one of those things that our body makes that helps us regulate sleep and help regulate our circadian rhythm. But when the melatonin is produced by the pineal gland, and that pineal gland is attached to your optic nerve. So when light is hitting your retina, then that pineal gland is quiet. It's not doing anything.
Yeah.
As soon as the sun goes down, the lights go off, that pineal gland's like, hey, my time, we got to make some of this melatonin. So if you are not keeping a regular schedule, meaning like sleep hygiene, we'll call it, if you're going to sleep at different times, if you're staying up and watching TV, if you're staying up on your phone, if that light is hitting the retina, then your body doesn't get those same cues that it's time to go to sleep. And so you're basically fighting against your own biology by trying to conquer that. Now, it's really difficult for individuals that have like rotating shifts. So a lot of, and that's difficult for a lot of the people that we depend upon. So the police force, a lot of them are rotating 12 shifts. The fire department, a lot of them are rotating 12 shifts. And
nurses.
My brother's an ER doc, and he does a lot of rotating 12 shifts and 12-hour shifts. And that's really hard for your body to kind of regulate back and forth. So it's really, really difficult.
Yeah.
I had to deal with that with my ex-husband was a police officer, and they would even as much as like shift like different shifts multiple times within the year, like days to nights. And it's brutal. It's hard on you. My brother-in-law's a nurse, and he'll do the same kind of thing. And he's even said before, the nurses that have been working graveyard for freaking ever just have all of these health issues.
Yeah.
And he's like, there has to be a correlation to that.
Definitely is.
Yeah.
And the research is pretty clear on that. But if you go to bed and wake up at the same time, whether it's a weekend or a weekday, then you're going to have a lot better chance at getting into those deeper sleep and keeping up on that. So we can actually have a sleep deficit, so it's like, if I just don't sleep at all during the week and then I sleep all weekend, does that make up for it? No. It probably feels nice to get some of that. I spent a long time trying to prove that right, and it never really worked out or prove it that you could. And it doesn't quite happen. Your body just doesn't. Yeah, it is unfortunate.
So what about, how can we qualify like what is good sleep? Like, because you hear like you need a solid 8 hours of sleep, or like as long as you're getting 6, it's fine. Or like, is it really that cut and dry, or is it a way that you need to be able to do sort of a self-awareness and check in and like, no, I'm good with 6, or if I get less than 8, I'm trash the next day.
And to touch on that as well, I kind of want to just tack in at the tail end, like sleep tracking devices, like the rings and the watches, like how well do those actually track sleep quality?
They are getting better and better. And so technology is amazing. So now a lot of times we'll do home sleep testing with similar type of technology. Cool. So one of the home sleep studies that we use, the physicians that we work with will use too, it's called a night owl. And it's just a sensor that goes on your finger, and it is looking at your heart rate. It's looking at your pulse oximetry, so it's looking at the level of oxygen in your blood, and it's also looking at what we call the little blood vessels in your finger. And so our involuntary nervous system, that fight or flight part versus the rest and digest part, the blood vessels respond differently when different things are going on. So it's watching the dilation and the contraction of those little blood vessels to kind of help tell what stage of sleep you're in. So some of those are very helpful as a screening tool, but they don't give as much information as we need sometimes.
Gotcha.
And so
if you don't have that, then like what are the things that you can look for?
And that's, how do you feel? A lot of it is like if you wake up in the morning and you feel like, man, I slept great, I'm ready to just go tackle my day. The afternoon comes along, you're still feeling energetic, and evening comes along, you're like, I'm starting to get tired, it's time to go to sleep. That's usually a good sign that you're getting the sleep that you need. The other is are you dependent upon an alarm clock? Meaning if your body is getting enough sleep, you'll wake up naturally. And if you're not waking up naturally, if you're pushing the snooze button 3 or 4 times on the alarm clock and your body is not able to take it, you're probably in a sleep deprivation state. Yeah. And so just being in tune with your body. And a lot of us just start to feel like, this is just my baseline. This is just how it is. Until we see something different, we just think this is normal for us. Well, whenever we have patients that get treated and they're like, this is how I'm supposed to feel. This is awesome.
Right.
And it's like, yeah. And I felt the same thing. I was like, I'm just getting older. And then when it was treated, I'm like, you mean I can actually wake up and feel like I can accomplish something today and get through my day? Yeah.
Wow.
That's incredible.
That's amazing. So, I mean, I think most people who've heard sleep apnea, they know about like CPAP machines,
Yeah.
et cetera. And so like anybody listening that's a little worried, that's like, oh man, this might be me. I really don't want to have to do that.
Yeah.
You mentioned before, and this is part of what you do, is like there's other options, can
Right.
be, depending on the severity, I'm guessing.
Depending on the severity
So,
and some other
Kind of
anatomical
walk us through
factors
what
and-
happens if somebody wants to come in and it turns out, hey, you know, it's either mild, moderate, or severe, whatever, we need to do
Yeah.
some things. What are their options?
So when we're looking, and let's say that we'll test,
Mm-hmm.
and we always see how severe is this issue, and then what are the issues? Because sometimes we have obstructive sleep apnea. When we're talking just apnea, we have obstructive sleep apnea, which is basically just a kink in the airway. Something is closing that off, and the airway's not open. We also have what's called central sleep apnea. Central sleep apnea is where your brain is not sending your body the right signals, and so you have sleep apnea, but it's because your brain's not telling your body to breathe appropriately.
Okay.
So the sleep study can be really important in differentiating between that. The sleep study, the home sleep studies and things like the Ring and even some of the Fitbits and stuff like that, they can usually give you an indication if you have apnea, if your oxygen levels are dropping. But if somebody is like, hey, I did the home sleep study, or my Fitbit says, hey, you're doing really good, and they still have those issues, then it's time to get what's called a polysomnogram. And that's where you go in and you're sleeping in a lab, you're hooked up to all the different machines. We're hooked up to an EEG, so we have brain leads on, so we know what your body is doing, what your muscles are doing, what your heart rate is doing, what your sleep position is, because there's so many different things that can tie into poor sleep that sometimes we just need more information. So that polysomnogram can be critical sometimes.
So you bring up sleep positions.
Yeah.
Are some sleep positions better than other sleep positions?
From an anatomical standpoint, just kind of thinking of airway, and when we're talking sleep apnea in particular, if you're sleeping on your back, then as soon as those muscles relax, that tongue will fall back, the airway will close off. So the majority of people that have sleep apnea, it will be significantly worse when they're on their back.
Gotcha.
And so a lot of people with either sleep apnea or the upper airway resistance syndrome, they can't sleep on their back.
Yeah.
And it's like they may try to or they may want to, but they can't. So they're always either going to be on their side or on their stomach. And that's just because your body needs that airway to be open. When you go to sleep, your body's like, hey, we want to have the heart beating and we want to have the air moving so that we can wake up alive in the morning. And it'll do whatever it takes to accomplish those.
You get that.
I know my
Yeah.
chiropractor would say, "Don't ever sleep on your stomach." He'll be like,
Yeah.
"Natalie, how are you sleeping?" And I'm like, "Well, kind of like that." And I'm trying to like show him, and he's like, "Stop that!" And I'm like,
Yeah.
"Okay."
But he might have to argue with your cardiologist
I
if
know.
you're not
Yeah.
breathing appropriately and it's causing some damage to the heart.
I can do
So-
some side. I kind of fixed myself a little bit to just go on my side instead of like keep going all the way.
You could
So.
get one of those
Yeah.
pregnancy pillows.
Oh my
that's
God,
like
I love the
total
pregnancy
you,
pillows.
and you
I
just
like
hug it.
actually still make my pillows do that, but I got rid of the pregnancy pillow because I
Yeah,
felt like it was
there's-
probably time. But it's so great.
I'll admit, I've borrowed my wife's pregnancy pillow.
It's
on a time or two,
fantastic.
and it's so much. Yeah,
It
just like,
takes
this
up
is-
so much, but it's just like
Yeah.
a cocoon.
Amazing.
Even if you're on your back, like your arms are up and your legs
Yeah.
are over it. Like it's,
Yeah.
I don't know what's not to love about that.
And some of the times that can be some of the indications that we look for. It's like, is your and even for kids, it's like, do they sleep in awkward positions? Do they sleep in the stink bug position? Are they kicking? Are they doing a lot of movement? And oftentimes that can be the body's way of saying, hey, if somebody is really particular with their pillow, they can't sleep on their back, they're really particular with their pillow, they're getting their pillow set just right to keep that airway open so that your body doesn't have to. And from an orofacial pain standpoint, neck pain and the facial pain that we see from that, I have to talk to patients about pillows all the time. Because of my own neck surgeries, I'm kind of
Right.
a pillow expert. I've tried every pillow. I've paid a
I'm
lot
an
of money
accidental
for pillows.
expert in a lot of different things.
So I'm
It's
really
interesting
curious.
treating some of the things that I've dealt
Yeah.
with myself. And so I can have conversations with my patients, from a little bit different standpoint where it's like, yeah, I get it. I understand. Here's what's worked for me and here's what's worked for a lot of my patients. And,
Yeah.
and so
Gives you a really unique perspective.
it does. Yeah.
Well, let's have some pillow talk.
yeah.
What pillows are good and what pillows are bad, and what makes it good or bad?
So you want a pillow that is firm enough to hold the position, but is not going to force you into any position. And so the ones that tend to work the best are those that are like shredded memory foam.
Okay.
And so, like my pillow is an example of that. But you'll have like the Posturepedic and some of those pillows that are like, hey, it's like here's a place for your neck to fit. And for some individuals, those work okay. I've had neck surgeries. Mine is a lot more temperamental about certain things. The best that I found a Costco 2-pack for $13
There
of
you
shredded
go.
memory foam pillows. And I've spent hundreds of dollars on pillows.
That's
Wow.
amazing.
And that $7 pillow works
This is not a
better
paid
than-
sponsorship.
It is not. It is not.
But there is a Costco right across the road. So.
Yeah.
We're going to get an affiliate link in the show description.
and I couldn't even tell you the brand because I don't even know if it like they promote the brand. But it's just I'll go there, and if Costco has one of the totes full or one of the bins full of that, there's one or two of those that go in my cart because I wear through them. They're the first thing that goes into my luggage when I'm traveling.
Wow.
And, yeah.
I love it.
Is there a
Critical.
lifespan for pillows?
Yeah.
When because I hate throwing away my pillows.
I
I just
know.
do. But like, when should I say goodbye to my
Now
pillow?
the smart aleck in me says it depends on how bad you drool. So
I bet you're a big drooler. I can see that.
yeah.
No comment.
We'll ask your wife.
when it starts losing its ability to hold that
Yeah.
shape, and so a lot of the memory foam is really good at that because it'll hold that shape a little bit better, and you can manipulate it to however you need it. But some of the pillows that are a little bit too small, it's going to be dependent upon the brand, but as soon as you're sapping to like, I'm going to fold my pillow over twice to get it to where I need to.
It's like
probably time to get a new pillow,
Just get a new pillow.
or a new pillow or a different brand. Yeah.
Okay, so I had kind of, prior to this pillow talk conversation, thinking this question, again, maybe kind of a two-parter. I seem to love those
You
today.
like those
I love the
two-parters.
two-parter.
Might have to remind
Two-parter.
you of the second part.
I know, yeah. Okay, so I'm wondering about mouth breathing when sleeping.
Yeah.
And if somebody's, like, even for example, my daughter, she tends to be a mouth breather when she's sleeping. And
Yeah.
so I've heard that's a signal. It's like something's going on there for sleeping and it can impact sleep. Second part being, let's talk about mouth taping.
Okay.
Okay.
Yes.
Okay. We did pillow talk. Now we're doing mouth taping. It's a weird episode.
Yeah.
Yeah.
One of
So
the brand
because
names is
those two
hostage tape. and-
right? Yeah, they like
yeah.
tie in together. And I know some
Yes.
people are like, "Why would you tape your mouth shut?" And so, like, why would you? And also, what are your thoughts on that?
So we'll start with the nasal breathing.
Yeah.
And the importance of that. So when we're breathing through our nose, our bodies are designed that way. So if we're breathing through our mouth, it's because the body is saying, hey, nose, you're not doing your job. Move out of the way. The mouth is going to take over. So one of the first things that we have to do for all of our patients when we're starting to get serious about treating it, I always take a CT. And I'm taking a CT of their airway and their cervical spine. Basically, we're looking from the opening of the nose to the opening of the lungs. Is there a restriction in there anywhere?
Okay.
So for a lot of us, and this is something that I love doing this with my patients. It's called the Cottles procedure. But so we have the nostrils, and just inside the nostrils we have what are called nasal valves, and then beyond that we have our nasal passages. So I kind of liken it to like you come up to a house and there's a screen door, and then there's a door, and then there's a hallway. So the screen door is the nostrils, the door is the nasal valves, and then the hallway is your nasal passages.
Okay.
And so for most of us, it's like if somebody has collapsed nostrils, you can see it. If those are narrow, then you're going to see it. If somebody has collapsed nasal valves, you're not going to see it. And oftentimes when you're looking at things like deviated septum and stuff like that, you're pushing beyond those nasal valves and looking beyond it. So you're looking at the entire sinuses, you're looking for deviated septum, you're looking for nasal valve collapse. So we can actually, nasal valve collapse, that's kind of an easy one to check just on yourself. But how we do it is just take it, just with lips together, just take a deep breath through your nose. And then breathe out. And then now just close one side and do the same thing. And breathe out.
It's a little congested there. I don't
Yep.
want to breathe out
Yeah.
too hard.
Yep. And then now just do that same thing, but you're going to just take
I
and
see
pull your
Evan,
cheek
our
off to the
producer, on the
side.
side doing this too. I'm loving it.
Yeah, yeah, but just
This one's
pull it
better.
out to the side and see if that makes a difference.
Yeah, I did a little bit.
So for
My
some
side was
individuals,
clearer.
I like to watch eyebrows because some people, they'll do that and it's like, whoa,
Whoa.
we're opening a door. So you've probably heard of breathe right strips or like
Yeah.
nasal dilators.
Mm-hmm.
Those
I
are
love those
holding
things.
the nasal valves.
I love those things.
Yeah, and
Yeah.
so most people that have nasal valve collapse, if they use those, then they can be really helpful. So I have patients that'll use those when they're exercising because they can't breathe properly through their nose. But
Interesting.
for sleep in particular, if you can't breathe through your nose, your body is producing some chemicals that actually help you sleep too as you're breathing through your nose. So
Okay.
the mouth breathing, the dry mouth, you're going to have increased dental problems. You're going to have a lot of issues from that. But when your mouth is open too, and if you're a child that is developing, that tongue is down, the cheeks are kind of pushing the teeth in, and so you're going to have to visit the orthodontist a lot more than somebody whose tongue rests against the roof of their mouth and keeps the dental arch wide and keeps the airway wide. So it's interesting how sinus problems in kids lead to facial deformities, and
Wow.
you can see that. We used to use derogatory terms like they're a mouth breather. And it's because their mouth drops open, their jaw develops differently, and their face looks elongated, and the roof of their mouth will be elevated, and it's because that airway just doesn't develop appropriately because the muscles are not holding the things where they're supposed to.
So what about mouth taping? And maybe
taping.
not necessarily go out and put, I'm not saying go put tape on your kids' mouths while they're sleeping, guys. I'm just,
Mouth taping,
Yeah.
First check the caudals and make sure
Okay.
it's like, hey, the nasal passages are open.
Okay.
If the nasal passages are open, then mouth taping, it just keeps and this helps a lot with snoring. So kind of think with snoring, it's this vibration of the soft palate in the back of the throat that is making all that noise. And I'll use the analogy. It's like, hey, if you're out watering the garden and you have that hose, all of a sudden you stick your thumb over the end of that hose, you're reducing the opening. And so that water's coming through a lot faster. It's a lot more turbulent. Air through the nose is going to be the same way. So keeping the nose open is going to make it so the mouth doesn't have to. So first we got to make sure that we have a patent nasal airway so that we can breathe through our nose.
Okay.
Then, for some of us, still, as soon as the muscles relax, jaw muscle relaxes, bottom jaw falls open, and now we're trying to breathe through mouth and nose kind of at the same time. And so mouth taping can be really effective for some individuals.
So, sorry, I'm just thinking through this
Please.
process. If your mouth is taped and you have these collapsed noses, which I guess that's what you're saying, is you got to
You
make
gotta
those
check.
open.
Yeah.
Otherwise,
Otherwise
if
you're
they're
gonna-
not, you're going to get that panic response.
Yep, and mouth taping will be counterproductive.
Yeah.
And so you'll usually find out pretty quickly, because if somebody's like, I tried that mouth taping, that hostage tape, I felt like a hostage, and I felt like it
Yeah.
was trying to kill me. And I'm like, well, let's check
Let's
the
not do
sinuses
that.
and nasal passages and see if they're open. And more often than not, yeah, there's some sinus issues, nasal passage issues that we've got to address first.
This is a random question, but like, so those nasal things that open up your nose,
Like the breathe right strips?
the breathe right strips.
Yeah.
You know, obviously those are like disposable, so they'll go through. Is there anything like that that's like more permanent that people can buy?
So
that actually
they're called nasal dilators.
Okay.
And if you go on Amazon, even you can buy them, and just nasal dilators. My patients' favorites are called HALE, like Inhale, Exhale, HALE, and they're little inserts that go into your nostrils and they hold that open.
Wow.
Cool.
And so you don't have to use that. And those, I've been at the gym and seen people where you can see just like a little clear ring. It's like, what, they got their nose pierced? It's like, no, they have the nasal dilators in
Oh,
to
funny.
hold those nasal valves
Interesting.
open.
Just so
Yeah.
that they can breathe through.
So
the
they
Okay.
can breathe through their nose, and and it's a lot better for them. A lot of distance runners will use those just so, hey, we're going to be breathing through my nose. It's a lot more appropriate and
great.
healthier for us to do that.
That's really cool.
So, yeah, nasal dilators. If somebody's out there and they're like, hey, I can really breathe a lot better like that, go on Amazon,
Well, I even
get
felt
the
just
nasal
kind of like
dilators.
doing the stretching, like after that it was clear. It's like I just needed a little bit of like help,
Yeah.
to
Yeah,
like
to get it
stretch
to
it
where it
open
needs
a
to
little bit.
I just an interesting story. I had a patient not too long ago, and I was checking that, and as I was checking it, he had some facial muscles that would literally pull it. He didn't have to like use his finger or anything like that.
Really?
He's like, no, I can do that. And
What?
That's
yeah,
interesting.
That's
he
so
can open
weird.
them up, and first time I'd seen that. But yeah,
I mean, I can
Not
flare
everybody
my
can do that.
Now that I'm
nostrils.
thinking about
I
it,
can
I mean,
flare my
maybe-
nostrils, but I don't think that's the same thing.
Yeah.
If people are making funny
His was
faces, now
impressive,
people
yeah.
are going to be. For those
it's like-
listening, you might want to check that out on YouTube.
Can you flare your nostrils?
Well, guaranteed, they're
I don't
out there
know if
doing
I
the same
can.
thing. Everybody's out there trying to do that.
No,
can-
but
I
your
can-
eyebrows doing a weird
I can
thing.
move my nose like a bunny, but I don't know if that's probably not
Yeah.
useful.
I can
Not-
flare my
not quite the
nostrils
same.
and wiggle my ears. So.
Yeah, me too.
Yeah, see? Well, sorry if
Well,
you're not
here
one of
we
the
are.
cool
Sorry,
kids,
you're just
Derek.
not as-
Yeah, you're
yeah.
not
Yeah.
cool. We're not cool.
Dang it.
All right. Do you want to jump into our new section?
Yeah, let's
of the
do it.
pod? So, okay.
So we have a new section, fact or fiction. So we're gonna
Like
just
quick
kinda-
draw.
It's a quick draw, kind of rapid fire. Go through a couple of things. I think that a couple of these things we've already touched on,
But let's do it
Okay,
again.
but we'll go through it and just get your quick take on
And
this.
then a quick little synopsis after you say fact
Yep.
or
Okay.
fiction. Okay.
Yep. So first, fact or fiction. I can catch up on missed sleep.
Fiction. So now the damage that gets done sometimes is irreparable. So that lack of sleep, any of those sleep-related breathing issues, any of the oxygen issues, not quite the same. Now, if you have a couple of days where you're not getting that good sleep, then you can catch up on some of that.
Okay.
But
So damage
long-term,
done,
no.
you can't really like recoup that damage,
Short
right?
term, yes. Long term, no.
So like if I have like such a crazy week and I didn't get to sleep till like midnight every night, but was still getting up at 5 or 6, and Friday night hits and I'm like, oh my God, I'm going to sleep until 10.
You're not going to catch up on the rest of the week. So it's not like, I have 100 hours this week and 30 hours needs to be sleep. So I'm going to do all that in a 30-hour stint all
Yeah.
at once. Not the same.
Not
Dang.
gonna work.
Yeah.
All right.
Dang, I'm really disappointed
So
in that
that
answer.
so that leads to the next one. Fact or fiction? More sleep is better.
That's a hard one. Fact or fiction? Fiction, I'll say, because it's the quality of sleep that is more important than the quantity of sleep. And so if you're getting 10 hours of junk food sleep, so to speak, versus 4 hours of nutritious sleep, then I'd take the 4 hours of nutritious sleep all day, any day.
Gotcha. I have some friends who, like, they say that they sleep 13 hours, 14 hours, and I wake up tired. I'm still tired. And so that's probably just like an underlying issue that's going
there's
on
something that's not letting them get into that restorative sleep.
Interesting.
Well, I've also noticed sometimes, even if I'm just like, oh, I can stay in bed, so I'm going to stay in bed, actually end up feeling more tired than if I'd just like gotten up at 7 when I woke up on a Saturday. Do you know what I mean?
Again,
Like
you're
it's just like
fighting your biology.
Yeah.
Yeah.
Oh, dang it.
Yep.
All
All
right.
right. So here's the next one. Alcohol helps me sleep.
Fiction, very much.
Ding, ding, ding.
Now, it might help you get to sleep.
Right.
But
Same with weed too, right? Marijuana if you're going to
same with
smoke
weed.
or, yep.
Yep. So it might help you get to sleep, but again, it reduces the quality of your sleep significantly. So you're not going to get into that deep sleep because it's a respiratory suppressant. So
And a diuretic as well, right?
Yep.
Yeah.
Yeah. And so, yeah, good luck with that. and why do you think why is a hangover? Because
Yeah.
you wake up and you have that, it's that lack of oxygen to your brain from some of those breathing issues that is causing a lot of that hangover.
Yeah.
So,
Yuck.
All right. So the last one, I don't dream. And I have a story to tell about this, but I want to hear your reaction.
we dream in REM sleep. So, and REM sleep is when our muscles we have atonia, so we don't have any muscle tone, and we're supposed to be paralyzed. We're not supposed to be moving. And that's when we dream. And so if you're not dreaming, then there's a good chance you're not getting into REM sleep. Or if you're having very vivid and almost like night terrors in kids or in adults, it'll be like those panicky dreams. You wake up and it's like, where am I at? Okay, I'm in my room, I'm okay. A lot of times that's as you're getting into REM sleep, your body's not letting you stay in REM sleep. So on functional MRIs, we'll usually see that's a very short, highly active moment for your brain where you're having kind of that very vivid dream.
Interesting. So
Because you're not getting into REM sleep.
It sounds like there's kind of a spectrum. If you're not having dreams, that's bad.
Yeah.
If you're having really, really vivid dreams, that's bad. And so you want to be somewhere in the middle.
You want to have those pleasant dreams. Yeah.
And what if
Sweet
like you
dreams.
could be dreaming and not remembering too,
Correct.
right? So it's
Yep.
possible someone would be like, I don't dream, but in reality it's happening. There's
Right.
just not a memory of it.
Yep.
And I don't like dream vividly all the time, but I've often thought like I must be just before REM because it is vivid, it is detailed. I'm aware a lot of the time that I'm in a dream.
Yeah.
And like sometimes I can even like
Can you
shape
lucid
the
dream?
story of my dream.
Wow.
I literally can be like,
That's impressive.
Yeah, kind of weird though, right? And then a lot of times remember the details of the
Yeah.
dreams. But as I'm in the dream, I'm like, this can't be really good sleep because I'm aware of what's happening in this story, and I'm like, what the hell's Grandpa doing here? You know?
Yeah.
And like this is what's happening in my brain. So I'm guessing not REM sleep if that's like.
Usually not REM sleep.
Okay.
Yeah, that's your body going through. And usually when we see those dreams, they may seem like they're lasting for a long time, but they're just seconds.
Wow.
And it's as your body is trying to get into that REM sleep, and your brain's like, whoa, nope, can't do that. We're not going
Yeah.
to be breathing if we're doing that.
Yeah.
Yeah.
Time perception is such an interesting thing with sleep. So this
Yeah.
is my story. Like so I went on a 2-year mission for my church. Before my mission, I like almost never had dreams. You know, I was pretty much I'd wake up or I'd go to sleep, and then next thing I knew I was waking up and going about my day. I went on my mission to South Africa, and and this is what I tell people, just because it sounds so weird, and it like to me it's so weird. As soon as I set foot on African soil, and every single night that I was in Africa, I vividly dreamt every single night, and it was just like I don't know, is this something that's weird going to me? Is there something in the air?
Weird.
Is there something in the water? I don't know.
Sometimes it can be the food.
Really?
Yeah. Interestingly, there are some foods that will increase some of that vivid dreaming. Now, I haven't dug into that really deep.
Yeah.
But for me, peanut butter M&Ms, whatever they have in that, I don't know if it's a dyes or whatever it is, but and that's one that's kind of fairly frequent. So
that's crazy.
Some foods will increase that. But for 2 years in South Africa, I don't know. Good question.
Yeah. So if you're not dreaming, what I don't know, how can you go from trying to not dream to remembering your dreams? Is that a good goal to have, or how do you go about doing that?
Kind of goes back to the testing.
Yeah.
And so if you have some of those other little red flags that are kind of there, it's interesting how many patients will, when we start treating their sleep apnea, they come back and they're like, I had some dreams, and I haven't dreamed in years.
Wow.
And we're like high-fiving, like, hey, that means you're getting into REM sleep.
Yeah.
And so testing to see why if there's a reason why you're not getting into REM sleep, it is critical.
Yeah.
Just what's your brain doing? Why is your body not getting into that REM sleep? And sleep apnea is not the only reason. There are some sleep disorders that are based off of different chemicals in your body, like dopamine and norepinephrine and serotonin, that can affect that heavily too. So just kind of ruling out the most common one, which is the sleep-related breathing disorders, is critical sometimes for that.
Definitely.
As we're talking about dreaming, and it makes me think about like all these things that are happening in the brain that we just like seriously have no idea and are not tapped into, and what are dreams and how much of that goes beyond what's scientific and like into spiritual, or if you believe in that sort of thing. And so like I'm just sitting here thinking, as much as we know now about how important sleep is, there's also all of these other spaces that good sleep could be touching that we're completely unaware of, that we may never fully recognize or realize just because of what's happening in the brain when we're sleeping. And there's just so much of the brain that's uncharted territory.
Yeah,
and so I'm just thinking that as we're talking about dreams,
For something that we do for a third of our life, we know so little about it. And it's like we do everything we can, and we're like, hey, let's use this medication, or let's use this route, or let's use this to try and get better sleep. There's still so much we don't know.
Yeah.
And the body's amazing, both when it's functioning right and when it's not functioning right. And so I guess all we can do is just try to find those things that, listening to our body, finding out if there are specific things that we know that are wrong with the body, and then not trying to fight biology. It's like just good sleep hygiene, good habits, staying away from caffeine, later in the evening especially, and exercise right before bed. Just doing those things that we know help with sleep, and trying to stay away from the things that we know help you not sleep.
I love it. Before we go, if there was like one little like tip that you give to people that you feel like is seriously underrated that not a lot of people know about. Like I've heard like don't eat after 7 p.m. Big impact on your sleep. Like if there was one little, we've talked about a lot of things here, but you're like, not enough people know this, and it's like so simple.
That is just, I even felt this myself. It's just, if you're not feeling like you got a good night's sleep, that's not right.
Okay.
Something is not right. And whether that's what you're doing, whether that's your sleep hygiene, whether that's some chemistry in your body that needs to be adjusted or regulated, whether that's sleep apnea, whatever it is, if you are waking up after, 8 hours of sleep and you don't feel refreshed, then figure it out.
Okay.
Go get tested. There's usually going to be something that can be done to help you.
Okay. Awesome. And what resources outside of going and getting tested? I think everybody should, but if anyone's like, I want to kind of try this on my own, what are some resources you would recommend for good sleep hygiene, to kind of do kind of a self-check and assessment, and like, okay, nope, I'm not doing that, and I'm not, okay, maybe let me try this.
Yeah, and technology is great.
Yeah.
As long as we're using it effectively, because there are even apps that'll help with that. You go online and there are
an app for that.
checklists of what to do for sleep hygiene, because a lot of those, sometimes we'll get into questions and question after question after question. Finally, somebody will be like, oh, you know what? I do this. So just being aware of those things that can make it so you're not sleeping well is going to be the most critical. So just personal awareness. And people that listen to, that are your audience, they're going to be usually the ones that are a little bit better at that, being self-aware, body aware, aware of the things that you put into your body, aware of the things that your body is trying to tell you. That's kind of the best advice I can get. Listen to your body. Yeah. Be aware of it. And if something's not right, question it and figure out why.
Yeah. Maybe we could even find a good sleep hygiene checklist that we could link in the show notes and kind of run it by you and see if you think it's a great idea. And then that way it's a resource for people to kind of dive into. And then beyond that, like, where can people find you?
So we're at Columbia Center for TMJ and Pain. .com.
Okay.
And then we're located in Richmond, Washington. We're just off of Columbia Park Trail, so just down off the river.
Okay.
And so, yeah.
Do you have a social media that you like post about any of this stuff? Or I know you said earlier that you go and do lectures, so I was not sure how much social media content you do. If
we
any.
do, and that's kind of been up and down. So yeah, now I have somebody that's in charge of like the
perfect.
That's in charge of that and working a little bit more on that. But yeah, if you go to any of our either our Facebook or Instagram, and you'll find some little videos and stuff. But,
awesome.
We'll link to those.
Yeah, we'll get a link.
Great.
Yeah.
But the staff loves to talk about it. So when you call, they're going to be asking some of these same questions, and it's interesting. A lot of the people that call up, they're like, "I've got more information off of the first phone call than I've gotten for quite a while." So, yeah.
I love that. That's amazing. Well, thank you so much for taking the time to come in today. It's been a
An
really
pleasure.
interesting conversation. Yeah. I'm really grateful that you took the time, and I'm grateful for the unexpected twist in your journey that kind of brought you here, because I think it's an important conversation, and I'm thankful that our listeners get to hear an interesting perspective on sleep hygiene and good sleep. I'm hoping it's going to bring a lot of awareness to people, and they can have a better, healthier, happier, longer life.
That's right.
Yeah.
That's right.
That's what we all work for, right?
Exactly. That's what we're all
Appreciate you
about.
coming.
Yeah. Thank
Yeah.
you.
Great.
That's it. Well done.
Okay.